Hi everybody, this is Shannon, the Iron Nurse Practitioner, coming to you with the complete guide to IV iron treatments. There's a lot of discussion online when people get ordered IV iron and they're worried about the IV iron reactions and the side effects of IV iron. So we're going to go over everything you need to know about IV iron. So let's go. So I wanted to share with you that I have also had an IV iron infusion. I have celiac, and before I knew that I was having a gluten issue, that my iron went down to nothing, and I was having heart palpitations, premature ventricular contractions, or PVCs, which is like your heart skipping a beat. I was having hair loss. My blood pressure went down to 90/50. I was having headaches every day. Of course, was craving ice, was cold all the time. So all of that before I got the IV iron infusion. I got Infed, which is that one that's just the one-time infusion. And the only issue I had was after the infusion, because of the pre-meds, because we give Benadryl with Infed, I was tired the rest of the day. But the next day, I felt fantastic. Every single symptom I had went away. So no more PVCs, no more heart palpitations, no more headaches, no more hair loss. All of those things resolved from an IV iron infusion. And I wanted to tell you that story because I know that you're apprehensive about the IV iron, but I tell my patients that no one has ever regretted getting IV iron. Because IV iron is 100% absorbed, you are going to get all that iron. So even though I wanted you to be aware of some IV reactions and things like that, so you'd understand it, I wanted you to know that this is a great decision to go forth with those infusions, and that I myself have experienced it and saw a total difference in my life from having the infusion. So I wanted you to be rest assured that it is a good thing to do these infusions, and now that you have all the information, you can prepare accordingly and then hopefully have no issues, and it's a great experience for you. So the irons that are on your screen right now are the ones that almost every major insurance carrier will cover for a first IV iron dose. That's why I wanted to put them on here. And Ferrheme or Ferromoxetol is an exception because not every carrier will allow that to be your first IV iron that you can get prescribed. And these are the infusion doses, how many they'll require, and these are generally how they're ordered, so your doctor may do something different. But Venofer is 5 doses and Ferlicet's 8, and Ferrheme is 2 doses. Infed, as you can see, is only 1 dose, which is great, but that's also a reason that it's on shortage across the United States all the time, because everybody wants the 1 dose. However, it is covered from major insurance carriers. And we'll get into why those infusion times are important later, but this is what I wanted you to see what they look like and what you're looking at for the order. Okay, let's talk about the good news first, because I know that all of you are scared about IV irons. So let's talk about the good news. First of all, there was a massive study done from 2015 to 2021 that looked at 35,000 IV iron infusions, and only 3.9% had any kind of side effect event of any kind. So out of 35,000, a very small percentage had any kind of event. So I wanted to ease your mind, first of all, about how rare these are. So that's number one. But then we're going to talk about this first type of reaction. It's called a complement activation related pseudoallergy, or CARPA for short. This is sometimes called a cytokine reaction or an infusion reaction. And these type of reactions, even though we're calling them reaction, the most important thing to understand is that this is not an iron allergy. So you're not having an allergy to IV iron. And that's why this one is important to understand it, because a lot of my patients have been told, oh, I have an allergy to IV iron, And really they had a CARPA or an infusion allergy or a reaction, sorry. And so it's important to understand what's happening. Not that anything should change when you're having an infusion, but just so you understand what's really going on and the differences between the two, so that you really understand if you truly have an issue with IV iron, or did you just have an immune system that hyper responded when it first got this iron. Okay, so here's what happens. So cytokines, which is an immune protein, and I've included a diagram so you can understand the whole cytokine network, because it is very involved. But in this CARPA reaction, what's happening is it is recruiting mast cells, macrophages, and tumor necrosis factor alpha. And the response is twofold. So it will first cause inflammation, and then it'll cause vasodilation. And the symptoms of this is going to be mild, and that's a very key term here, mild chest tightness and chest discomfort, mild. And then it would be mild back pain or lumbar pain. And then it would also cause, from the vasodilation, some facial flushing. It may cause headaches because of the vasodilation, and itching of the skin because of all of the vasodilation and the blood rushing to the skin. It can also, from that vasodilation or the inflammation, cause some nausea. That would be normal, some nausea, and then some anxiety. And you can have anxiety because you're iron deficient, but you could also have anxiety because you don't know where these symptoms are coming from. So those are the main symptoms that would happen with a CARPA. And the symptoms typically would start within the first 1 to 10 minutes of the infusion. And here's the biggest part. If nothing was done and you received no drugs, then this would resolve on its own. I'm not saying to not have any intervention. I'm just letting you know that this type of reaction, if you simply stopped or slowed down the IV iron, this would resolve completely on its own. Okay, and we're going to get to talk about why this can actually intertwine with a pseudo overload of iron, and then why I recommend getting the iron slower because of these things. In the previous slide, I explained how a CARPA can mimic a pseudo iron overload symptom and vice versa, and I wanted to explain how that can happen. So another set of authors that looked at IV iron infusions stated that these iron infusion reactions can occur from free iron in circulation not being able to be picked up fast enough by transferrin. And so what that basically is saying is that the iron is being infused too fast for the body to process. So that's a pseudo overload symptom. And how can that occur? So I've included how at any given time a man and a woman have about 170 micrograms or 150 micrograms for a woman per deciliter of iron in the bloodstream. And a deciliter is just a tenth of a liter. And the average human has about 6 liters of blood, and 1,000 micrograms is equal to 1 milligram. So that equates to about a 0.15 to 0.17 milligrams of iron per 0.1 liter of blood. And the smallest amount of IV iron that is given via infusion is 125 milligrams, with the average infusion rate being about 10 milligrams per minute. And the newer irons are infused at about 35 milligrams per minute, all of which is much more than what your body is used to. So that's how these pseudo iron overload symptoms can happen. And I've included some of those symptoms which do mimic CARPA, but I've underlined sweating because I have noticed that sweating kind of tends to occur with this pseudo overload versus the CARPA symptoms more uniquely. And this again shows the need for infusing this iron slower so we can help to mitigate and minimize these symptoms. I wanted to explain to you what a true IV iron allergy would look like. So first, the good news, That same study that looked at 35,000 iron infusions, those authors showed that only 2 of those infusions needed epinephrine administered. And epinephrine is administered when a reaction is causing very serious complications. So that only had to happen twice. That's how rare an iron allergy is. So that's the good news. And this type of allergy is mitigated by a different type of pathway of the immune system from immune globulin E or IgE. And this type of response it may have some of the same symptoms of the infusion reactions with redness and itching, but this response will have a very different appearance because this will cause welts. And the welts may start in one part of the body, but they will progress to all over the body if the exposure to the drug continues. And also it'll cause tongue and throat swelling and even wheezing from the bronchioles starting to swell. And this type of reaction can happen at any point during the infusion, and the symptoms can progress more rapidly the more rapid the infusion rate. So that is why I included that these symptoms will progress faster the more the faster that the iron is being infused. Another reason why infusing the iron slower is so important. And although it can occur during the infusion, it can also occur rarely after the infusion, but this is why your doctor will keep you for observation just to make sure you don't have this type of reaction. And these reactions, IgE-mediated reactions, do not get better without medical intervention, and they will not they will reappear if you are exposed to that same iron again. So if this is you, not all hope is lost. If you can only get IV iron you can only get iron through an IV, you can successfully get IV iron again, but it requires lots of precautions and pre-medications. But I myself have done that. So I wanted you to know that there is a way to get IV iron if you've been had an allergy to it. It's just going to require a lot more pre-medication and precautions. So these are my pre-treatment recommendations for the least stressful, easiest IV iron infusion you can have. First and foremost, you have to get an IV for IV iron, obviously. And so hydrating day before and morning of is your best way to get an easy IV. So when you are dehydrated, you've had tons of caffeine day before, day of, you haven't drinking a lot of water or other non-caffeinated drinks, then your veins, I like to call them like paper mache, so they like to blow and it's hard to get the catheter to go in, so it might take multiple sticks. So for you to have an easy IV, if you will hydrate day before, day of, that is going to help you. It doesn't mean you can't have caffeine, just don't count it as hydration. Now, obviously, people with fluid restrictions need to follow their doctor's order, but if you can hydrate freely, please do so. And then eating a good meal within 2 hours of your infusion. This has prevented tons of issues with nausea for my patients. So if they had an infusion in the afternoon, I'd tell them to eat a good lunch. If they had an infusion in the morning, I'd tell them to eat a good breakfast. And I just tend to not have any nausea symptoms when patients would do this instead of when they came on an empty stomach. So please eat before you go. And then bringing a blanket. The fluids that are going to be going in are room temperature, so 70 degrees-ish, and you are 98 degrees. So that fluid going in is going to make you awfully cold, awfully quick. So if you bring a nice blanket that can cut down on that feeling that you're freezing, they have them there, great, but if not, you are set. And then if you can, laying back in the infusion chair. 2 reasons for this. One, when you get your IV started, if you'll lay back and you are nervous about that IV, you don't like needles, then this can prevent you from your blood pressure from dropping. So if you can lay back for the stick, that's great. Also, if you'll lay back for the infusion, that can also prevent some of those pseudo reaction symptoms of the blood pressure dropping, feeling nauseated, all those other things. So if you can lay back, that will help you as well. And then the IV being in the forearm or the hand. And why do I like to avoid the bend of the elbow? Well, the bend of the elbow, so obviously your arm bends. And I included a picture from Nysora on what IV catheters look like and some of the lengths. So I used to love to use 24 gauges on my IV iron patients, and you can see that that catheter is quite small. It's only half an inch. And those veins in the bend of the elbow, although they are usually nice and big, some of them are quite deep. So if you just have a half-inch catheter in there, then if you inadvertently bend your elbow, then that catheter can come out of the vein and go into the tissue around the vein. Now, what the problem with that is with iron is that iron, when it goes into that subcutaneous space, the tissue around the vein, it can permanently stain the skin. So you could literally have a big brown spot in your arm if you bend the elbow. Now, you can tell me that that's your best vein and you want it there. Just know that that can happen. And so if you want your IV in your bend of your elbow, then just make sure you're keeping your arm straight and that you can avoid those issues. And then ask for the infusion to be over an hour. So two reasons for this. One, we can prevent some of those pseudo overload symptoms, pseudo reaction symptoms by just going slower. The typical thing that will happen is if the manufacturer has recommended that the rate of infusion should be 15 minutes, and that is what your nurse is going to give it to you in. So if you can just politely ask your nurse to infuse it slower, then she may have to ask the doctor, but she shouldn't have any problems with that. And it can prevent a lot of things for you. So if you can just get that infusion done slower, then you can do that. And then now that you've seen this video, you can also ask the doctor that when he writes the order, that he can write it to be infused slower. And he won't have or she won't have a problem with that as well. So those are the recommendations that can give you the best IV iron treatment and infusion with the least amount of side effects. Another thing that can happen with IV iron is a post-iron hypophosphatemia, which just means low phosphorus or low phosphate level. And this occurs because iron can increase the excretion of phosphate through the urine. And phosphate and electrolyte is needed for many functions, specifically muscle contraction, muscle contractility. And this used to be only thought to happen with Monoferric, a US brand, or Pharinject, which is a UK brand. But now it's believed to be more related to any IV iron in people that have low vitamin D levels, low calcium levels, or high parathyroid levels. So the symptoms can vary from each person. They can last up to 14 days after an IV iron infusion, but you need to know what they are. So it would be a lot of muscle weakness, fatigue, malaise, which just means that general feeling of unwellness. I like to call that just this feeling like a truck hits you and it's just really hard to get out of bed. Irritability, appetite loss, and even some numbness. So this is why some people can feel worse after an IV iron infusion, and it's probably because of phosphorus. So knowing that vitamin D might be an issue, calcium might be an issue, you can preload before you get an IV iron infusion of vitamin D or calcium or both, and then afterwards or just before and after, you can eat foods that are rich in phosphorus, and I've included a list here. So my recommendations after you've gotten an IV iron infusion is the first and foremost is hydration. So same as with your pre-hydration, post-hydration is just going to help your body to process that iron. So giving yourself electrolytes and hydration, as long as that's not contraindicated for you, that will just help your body to process and your kidneys to process the iron. Eating meals high in phosphorus for the next 3 days to avoid any of that low phosphorus levels. That can help you as well. And then the resting the day of the infusion, because your body is being taxed by trying to process all of that iron. So not asking it to do heavy workouts and lots of sweating is going to help you to process that iron more efficiently. And then to report any concerns that you have with the provider, we'd rather you tell us a concern and we can just alleviate your anxiety and it be nothing than you having a true issue and you not calling the office. So there are no dumb questions. So just call the office if you have any concerns about your iron infusion. And then following up with your hematologist every 6 months to a year, or the doctor that diagnosed your iron deficiency, this will prevent you from getting to that very low place again. So if you're getting that iron checked regularly, we can catch it before it becomes a real problem. So make sure you're following up every 6 months to a year on those iron levels, okay? So I hope this video has helped you feel empowered and confident about an IV iron infusion. And if you feel like this can help somebody, please share it with somebody on YouTube or Facebook. And if you have any questions, leave them in the comments and I'll try to get back to you. Thank you so much. The Iron Nurse Practitioner.